It's Dr. Mark Lerman. I'm a psychiatrist, and I work currently in outpatient at Stony Brook Medical Center.
And I'm Dr. Andrew Deptula, a clinical psychologist. I work at Stony Brook University Hospital at the Adult Inpatient Psychiatric Unit. My passion throughout my professional career has been trying to understand and treat individuals with severe mental illness. But I didn't really focus so much on anger until I got into like a truly immersed clinical setting. And you get to really see at firsthand the impact that anger has on the patients, but also the staff around them and the other patients as well. I'm trying to understand a way to improve the violence and the aggression that occurs on units.
I've worked in these state hospitals, including the one the study was done on as an inpatient psychiatrist. And I think the most poignant moment ever was one of my very gifted psychiatrists was brutally assaulted. Blood was everywhere. I went, like all of us, ran to the scene and helped debrief her. And I realized that we really have to do something about this. I had known Ray Novaco because I invited Ray to do grand rounds in my hospital. And he was a brilliant researcher in this regard. And then I got a hold of Andrew, who I knew from 10 North as well, and knew he was one of the young, vibrant psychologists on the unit, and asked him if he was interested, and he agreed. And then we concocted this study. But
as there hasn't really been a lot of research done in acute care settings with anger before, we wanted to sort of get a sense for whether or not these patients can reliably self-report their anger, even early in hospitalization. So one of the things we wanted to do was provide them with a lot of different anger and aggression measures, and conduct a couple of reliability and validity analyses to make sure that self-report is reliable and valid. And so that's exactly what we found. We found really strong reliability, really strong validity. So we can trust the results, or at least in this particular case, which is really good to know, because then that sort of sets us up for the next two set of results, which are that a patient's self-report of anger does actually predict their self-report of aggressive behavior. So there's a link between anger and aggression there. And finally, patient self-report of anger was prospectively predictive of a nurse's reports of aggressive behavior later on. So what that really means is that a person's self-report of their anger can later then predict if they're going to act out on aggressive behavior as reported by nurses' observations. I think a really great opportunity here would be to try and come up with some interventions here that would target anger. And that's something that we've sort of done in a couple of different ways. One's, as Mark alluded to, a part of the project was also the development of individual treatment that was sort of a loosely hybrid approach of individual and group therapy that was conducted on the inpatient unit. So it served more of like a 2-week stay as opposed to more of like a 3-month or a 6-month stay at a longer term facility. More recently, I've been in contact with a couple of researchers here at Stony Brook, and we just submitted an NIH grant that's looking at the development of a tool that's designed to intervene during those first 2 days, the days in which it's really the most probable that someone's going to regress, to see if we can provide them with some tools so that they can hopefully reduce their inclination to aggress at the time. So workplace violence affects a lot of people, a lot of things. So I do think that there's a lot that can be done.
On the other side of the ledger is the cost to the patient. And they don't recognize really the cost of their anger and aggressive episodes. And so, we're doing not only a service to nursing, who, has the yeoman's task of treating this. When we leave shifts, the nurses are running the unit. But the patient's got to leave the unit realizing that what they bring to the equation, which is their own anger and aggression, and getting control of that, learning about it, understanding it better, will help patient care, not just their short-term stay. So it cuts across both dimensions. The staffing piece, which I was initially interested with Ray Flannery's program, the Assaulted Staff Action Program, but also the cost to the patients themselves for their own anger. Yeah, I just, again, think that we need more research on the connection, right, between patients' anger and its implications for violence on inpatient units, but also in society, to say nothing of the violence in the world right now, and in our own country, in terms of these horrible school shootings, etc. So this is a fundamental public health challenge, not just to inpatient units, but it's vital to all levels of society.